Thank you for staying with us. May 17th of every year is observed as World Hypertension Day.
And that was yesterday, by the way.
And it's been since 2005. The aim is to raise awareness and promote the prevention, early detection, and treatment of hypertension. This is particularly significant in Nigeria, where 1 in every 3 adults, 1 in every 3 has hypertension. It has no symptom. And by the time you begin to know that you have hypertension, it's like you already have one foot in the grave. Hence, many people with this condition are unaware of having it, and only a few of those who are aware are on treatment. Furthermore, most of us who are on treatment do not achieve normal blood pressure, mainly because we do not take our tablets, our pills, regularly. So, how do we deal with hypertension, which is a leading cause of stroke, heart failure, chronic kidney disease, and heart attack, which may result in death or disability? Well, keep your gunpowder dry. We have a doctor in the house who will answer all those questions. Welcome to Sunrise, Dr. Oyewole Kushimo, consultant cardiologist, Lagos University Teaching Hospital, and he's also the Lagos State Coordinator of Nigerian Hypertension Society. Good morning.
Thank you for having me.
So there is such a society?
Yes, there is.
Hypertension Society?
Yes.
Who are the members? Those who have hypertension?
No.
Or those who treat those who have it?
Only those who treat those who have it, who are very medical experts.
The medical
of varying
experts.
specialties that have an interest in hypertension.
Okay. I don't even know where to start, because you say it has no symptoms.
Well, let me even begin with this. I mean, the shocking information you gave us earlier, that
1 in 3
of every 3. So one of us here now, the 3 of us here now, one of us.
Present, sir.
And that is not also discountenancing young adults. Is that correct?
No.
The challenge here that I see is there are a whole load of people watching us right now who have no idea
that they have hypertension.
What do we do?
Or rather, what should they do to find out so that they can go get help immediately?
Exactly. Well, that is why we're having this program. That is why we're speaking about it. That's the whole essence of World Hypertension Day, is to create awareness. Because being is a condition that is largely asymptomatic, most people don't know. So the main way that people find out is usually by screening, by incidental, checking of their blood pressure. So what I'll advise is that for people, the whole population should check their blood pressure regularly. So I think that is the only way we can actually detect most people. And we also encourage, even opportunistic opportunities. People should, each time they go to hospital, whether it's for whatever condition, check your blood pressure. Or you accompany a relation, check your blood pressure. People come to your office to do screening, participate. Check your blood pressure, from time to time. And that's the way I advise people who are watching this program, who are not sure, especially young people that have a family history, that even at higher risk. If you know one of your parents or both parents have hypertension, then you should be on the alert to check it from time to time.
Why is that?
Inherited?
Yes, there's a genetic predisposition, we call it. So it is not it's not like sickle cell disease or something that it's so. There are some conditions that are directly here. Yes, you have genes that put you at risk of having hypertension. So there is what we call a genetic predisposition. So it's a risk factor. Meaning, obviously, the fact that your parents are hypertensive doesn't mean you will have it. It's only a percentage, but your chances are higher than somebody who doesn't have parents who are hypertensive. So your risk is higher, yes. So there is a genetic predisposition.
Of all things to inherit.
Yes, but of course, it also depends on your lifestyle and also on environmental factors. All these things come to play. But yes, there is a genetics play a role.
By the way, this is a sidebar kind of topic. There is also something you call hypotension.
Okay.
Right?
Yes, there is.
What is that one, and how does that play in this whole thing?
Well, so first of all, everybody has a blood pressure. So that's one thing people should not. The abnormalities of blood pressure is not having. If we need a blood pressure to survive, everybody has a blood pressure. So, but what we don't want it to be too high, and we also don't want it to be too low. So hypotension just means when your blood pressure is too low. And that is a different condition, entirely, and usually what causes so many things can cause it. But first of all, if somebody is on hypertensive, if it's somebody who's hypertensive and who's on drugs and takes an overdose, or the drugs are too high for the person, that is one of a very common reason why you can have hypotension.
Please do not use the word drugs. Please use medication.
Medication is okay. I think, yeah, thank you very much for that. It could be misconstrued.
It could be misconstrued, yes.
So medications, yes. Medications, yes. So taking an overdose of medication, or a medication that is probably too high for that person, that can lead to low blood pressure. That's a very common cause, especially among people who are hypertensive. They can actually go due to over-treatment. But many other disease conditions would have heart problems, for instance. If your heart, because the blood pressure is actually generated by the heart. When the heart pumps blood out of the body, that's what creates that force. The force of blood pressure is created by the heart. So if your heart is too weak, for instance, those are what we call heart failure, which like the heart's like a pump. And if that heart muscle is a heart muscle pump, and if that pump starts becoming weak, tired, and not pumping as it should, those who have heart failure tend to have low blood pressures. Often people with infections, if you have a very bad infection that has gone into the body, very, very bad, we can have what we call shock, septic shock. That is when you have severe infection that can actually make your blood vessels to dilate, and that causes your blood pressure to go down. Then usually people who are very sick, terminally ill, maybe with cancers, or even with dehydration, for instance, if you have dehydration or you have diarrhea, you lose a lot of body fluids, that can also make you have hypotension. If you have like cholera, for instance, or very severe diarrhea, and you don't replenish the fluids that you're taking, that can make your blood pressure go low. Or if somebody has a road traffic accident and is bleeding, firstly, losing a lot of blood can also make your blood pressure low. So many conditions, many serious ill conditions, and the condition that cause serious illness can make your blood pressure go down.
It sounds like you're saying if anyone has high blood pressure, it sounds like you're saying if anyone has blood pressure, you should go and donate blood.
No, I'm not saying that.
Because you said loss of blood.
Yes, I mean loss of blood, abnormal loss of blood. So if you start losing, if you're bleeding, you have an accident or a wound and it's not being controlled. But of course, going to donation is okay as long as you're a healthy person, you don't have any serious illness. Yes, you can donate blood. They usually will not donate more than a pint in it, and usually it's spaced out. So we don't take too much from people.
Okay, Sam. Jonathan Elizabeth is asking, what are the causes and prevention of period-induced hypertension?
Period, okay. I was going to ask you, what is the cause of hypertension?
Well,
okay, so hypertension, first of all, there are two broad types of hypertension. The first type, which is the most common type, is what we call essential or primary hypertension, which is hypertension that most people have that is not due to any particular organ abnormality in the body, like a kidney problem or a hormonal imbalance causing it. It's usually the type that most people have, and this is called primary hypertension. And it is what we call multifactorial, meaning it is due to many risk factors come into play to have it, which we talked about genes earlier, having the genetic predisposition. You have relations who have hypertensive, that can one. Then your lifestyle, maybe being overweight or not being physically active enough, or dietary indiscretion, taking too much salt in the diet, and all these things can their interplay can come in. And obviously even environmental, air pollution and all that. So all these things can come in together to make you have hypertension. So that's the type that most people have. In 90% of the case, or 95%, most people have this primary hypertension, whereby it's a mixture of different risk factors coming together. And sometimes we really just don't know. People just develop hypertension. But then the other smaller percentage of type of hypertension, that is called secondary. That is, someone has a kidney problem, they now develops high blood pressure. That's what we call secondary hypertension. That is, probably has some abnormality in an organ in the body that now causes the BP to go up. But most people, what they have is the primary type, in which you have risk factors coming into play, and we can't really identify a specific cause to it. But the blood pressure is simply high.
But how about the period-induced one that Jonathan Elizabeth is asking?
Okay, well, so the thing is, that will have to be looked into, because people who have, who are undergoing periods, of course, with the hormonal changes that occur, people can have, different things can go on in the body, and perhaps one of these or maybe, they can have some kind of, like when one is under stress, you have some hormones that are being released. Maybe that could contribute to BP going up transiently and all that. But such people really have to be monitored, because what we call hypertension really is sustained hypertension that is there all the time, and that is not something that just comes up transiently and goes. So if somebody is having sometimes some people can have illnesses like a very transient, maybe they're sick in the hospital or one is about to go for an operation. Sometimes periods of acute stress can make the BP go up transiently and all that. But hypertension that we really emphasize is that's what we call sustained elevation. BP being sustained all the time, not just when I'm sick or when I'm having some abnormality transiently, but BP that's there all the time. That's the real hypertension that we focus on.
At what age should one begin to pay attention to one's blood pressure and check it on a fairly regular basis?
Okay, so now the thing is that there is no, I would say, clear-cut fixed age. What I also say generally is that the older you get, obviously, the higher your chances of developing hypertension. So obviously, the older you get, it is more important to check it more frequently. But actually, people of all ages, people who are, even children can have hypertension, something to know. Of course, their hypertension tends to be more the secondary type, maybe children that have some problem with their kidneys or some specific genetic or hormonal imbalances they can have. So when sometimes you have childhood hypertension, it all does exist, which is why even children, if they go to hospital for different for conditions, so different, their blood pressure is actually checked. But of course, the incidence of primary hypertension is much lower in children. So which is why, of course, we tend to emphasize adults more because they are at higher risk. But actually, people of all ages really, if they have the chance, yes, check up BP from time to time. But I would say the older you get, it becomes more important to check it more regularly.
Okay. What about the issue of an enlarged heart?
Okay.
Most athletes have enlarged hearts. Does that have anything to do with developing hypertension?
Not directly, no. No, so in the case of athletes, now having an enlarged heart can be due to many things, but in the case of athletes, it's actually an adaptation of the body, physiological adaptation. The body is trying to adapt to that, his athleticism, and actually is doing that so that he can be much more fitter and make them more, to make the heart more efficient so that they can do more, than the average person. So it's actually the body. Somebody who is an athlete who really does a lot of exercise, like marathon runners, very, professional athletes. The body, the heart kind of adapts so that he can even do more than he normally does. So the heart could enlarge a bit or thicken slightly, and then also the heart rate can also go down. These are physiological changes. That if the person stops doing the athleticism, it stops becoming an athlete and starts being a normal person, all those things are actually reversible. So they can actually, yes, it's reversible.
So the large-heartedness will come down?
Yes, can come down, yes. So it's something that we don't consider it's an adaptation. They're not ill. The body is adapting to that condition, and it's also reversible. Well, of course, different from those who have enlarged heart because of disease conditions like alcoholism or even hypertension. Over time, can make your heart get enlarged. That's a different scenario. But
you keep
in the case
emphasizing
of athletes,
professional athlete. I know some people who are not professional athletes yet have enlarged hearts.
Yes, you're right. Yes. They may. No. So, yes. So you can have, as I said, you can have your heart can be enlarged. Vigorous exercise is not the only reason why your heart can get enlarged. So that's when I say professionally, or even somebody who's not a professional but is doing, maybe he jogs 3 hours every day, for instance. You have such people. Every morning before they go to work, 2 hours, they do that. That's such a person is behaving like an athlete who does, So such people call this athletic conditioning. So even if you're not an athlete, as long as you do vigorous exercise a lot daily, like an athlete would do, like a professional athlete would do, yes, you can. Those changes can also occur. I have patients who are just bankers or normal people who jog so often that their pulse is actually low and they have these changes. But they are reversible. They are things that over time can go back. We don't consider it as an abnormality per se, as something to be treated. It's part of the...
Nothing to be treated?
Yes, we don't. But we have to differentiate it from the other type, which is due to maybe hypertension or due to other problems. That is a different matter.
Okay. Now, 2 things. Is it curable?
Hypertension? So, for the vast majority of people, it is not curable. It is what we call treatable and controllable.
Okay.
But however, as I said, those 5% that have secondary hypertension, if you treat that problem that is causing it, yes, potentially the BP can go. But those are just 5%. For most people who have the primary type, it is something that we manage, we control, and we don't consider it curing. Yes.
So how is the management or control done?
Okay, so it's done in two broad ways. So we can use, lifestyle measures, and we can use medications. And lifestyle measures is what we always start with, especially people whose blood pressures are not very marked, just mildly elevated. And even everybody who has hypertension too, we are advised to these lifestyle measures. And of course, they include taking care of your diet, increasing the amount of vegetables and fruits you take, because they have potassium, which helps to lower blood pressure, and also taking reducing your salt intake, not taking excessive salt, and that also helps to to improve the blood pressure. Being physically active, physical activity, not being sedentary, not just sitting down in the office the whole day and then you drive your car and then you sit at home. So we want people to walk around, so to do moderate exercise, like maybe 2.5 to 3 hours in combined in a whole week, or 1 hour of vigorous exercise a week. That is encouraged to stay active. And then also, of course, shunning away from harmful things like smoking, avoiding alcohol if possible, or taking just moderate quantity. So these are measures that we advocate, and they can actually help to lower the blood pressure to some extent. And also those who are on drugs, medications, it can actually make the medications work better. Then, of course, the second major way is to using medications, which is obviously done by a healthcare practitioner who will now prescribe. Usually on top of these lifestyle measures, we now add medications. And then these medications, of course, some people can start with 1 or 2, and sometimes, unfortunately, we need 3 or 4, depending on the level of control. But what we try to do these days is, because control is a problem. People get tired of taking drugs for so long. So measures are being taken, for instance, to make combination pills. Those who need to use 3 or 4 drugs, we now have companies that make 2 drugs in 1 tablet. We call them fixed dose, single pill combination. So that also helps to, tolerance, so that people, they're not swallowing so many tablets. And we try to, encourage this also. So these are the 2 broad ways, we combine lifestyle measures and medications.
Well, Elizabeth is back. Jonathan, Elizabeth is back. Based on the period-induced hypertension, should one be on medication because the blood pressure returns to normal after the period?
So, I would say in such a scenario, it's not a one-size-fits-all. So first of all, it depends on what the person means. How high does it go? And so I would say in such a person, we need to take a holistic review. The person has to be fully evaluated. We need to first check, for instance, whether you have any signs that hypertension has damaged the body, what's the risk profile, what other conditions you have, and what's the level of this blood pressure. Because if the blood pressure during the period just rises to very, very, just slightly above the normal, you may not need to use medications, for instance. You can start lifestyle while we monitor and see the trend. Because it's something that is varying, and we also do average. If you have a person who has blood pressure that is going up and down, we can check it. We can do what we call a 24-hour measurement with a special machine, or we can do blood pressure at home and we'll take an average. So if the average is not elevated, the person may not even need to be on medication. So it actually depends. So it's not something that I can just give a fixed.
Another leg to that is pregnancy-induced hypertension. Mm-hmm. Are they similar?
Yeah, so pregnancy-induced hypertension is something that does occur, and usually would occur in people towards the second half of their pregnancy. So beyond 20 weeks, usually most pregnancies last, around 37, 38, between 37 to 40 weeks. But around the midpoint, around 20 weeks, some women can develop hypertension because of certain things that happen in pregnancy, the hormones that have been produced, and some conditions can lead to what we call pregnancy-induced hypertension. Usually in such women, we monitor them very closely, because and depending on the level, they may need to also be on medications. If the level is very high, they are monitored very closely because it can lead to complications. Most often, if it's truly pregnancy-induced, it actually resolves. So usually about 6 weeks after pregnancy, many of these women, the blood pressure actually goes back to normal. And if that happens, we stop medications and we monitor them, because what has been shown is that people who are pregnancy-induced hypertension, they're also at risk of developing sustained, chronic hypertension, we call it, the usual hypertension later in life. So
after having...
Yes. So even if it goes to normal, we monitor them, we advise them to check it, from time to time, because they could also develop hypertension in the future. But usually pregnancy is something that can actually resolve on its own once pregnancy is over. If it's truly pregnancy-induced, it can go back to normal, and then we observe them, and they live their normal lives after
How
pregnancy.
are you coping with the management of your patients who have hypertension now, especially in light of the fact that the cost of drugs has hit the roof?
Yes, it is a big problem. It is. I mean, our patients are really, because these are drugs that they need to take for the long term. They have to. So what we are doing, daily. So it is a challenge, I must say. So one thing we are doing, of course, first of all, I think one thing that should be encouraged is we need locally produced drugs. Because one thing we realize is that the few that are not, there are some actually locally produced.
Manufacturing
and the price
sector not being encouraged in Nigeria right now.
Yes, unfortunately.
Most manufacturing companies are shutting down.
Exactly. No, but what I'm saying is, we have some Nigerian companies that make drugs. Okay. So it's actually something that some people are not even aware of. We had this discussion even on our platform where somebody asked, are there any drugs that are produced by Nigerian companies? And there was a long list. I realized, wow, we do actually have some companies that are actually making drugs locally.
That have the right ingredients.
Yes. So they're available. They're not all the brands are available. I've been looking for that. A good number. Actually, the common ones, like amlodipine, for instance, there are some that are locally produced by registered companies. And what I would like the cost difference tends to be is quite significant. So this is one of the measures. But what I'm advocating is really we need more of this, and so that we can have that more affordable drugs. Well, obviously another thing is healthcare coverage. We are also pleading that the government, universal health coverage, people should have more access to health insurance. This will go a long way. But it is a challenge, and I must say it is a challenge. People are complaining. So a lot of times, people who are using expensive drugs, they complain. We have to look for cheaper alternatives. Some, even those cheaper alternatives, they are struggling. So it is a challenge, I must say. But we are looking for means and ways to see how we can help our patients.
You were talking about high blood pressure, low blood pressure, and there is that endless contestation about the average. Almost every advert you see, you see 120 over 80 as the average. In fact, some say that is it. If you don't get 120 over 80, forget it. Yeah, either too high or too low. Is there such a thing?
Okay, so let me make some clarifications. So we have what is called, so the level of 120/80 is what, we could refer to as, you could say, ideal or physiological blood pressure, ideal, blood pressure.
For adults.
But that is not, but however, it doesn't mean everybody has to have exactly that figure. So that is, then above, now, the cutoff for hypertension is 140/90. So what that means is your blood pressure is 125 or 75. You're doing fine. But no, there's no need to panic. No need to, So because actually blood pressure is also something that goes up and down. So it's not something. So we have that range in which in fact, we say optimal blood pressure, normal 120 is still regarded as normal blood pressure. When you're about between 130 and 139, then we say, okay, this is getting borderline. So between 120 and 130 is still considered normal. Even though, yes, there's 120 is like, okay, ideal, but 120, 129 is actually considered normal. So if you have your BP is 125, you don't need to panic. You don't need to bring it down. And even getting too low, below 120 is also not even encouraged. When somebody is hypertensive and we're treating, we don't even want it to go below 120. We don't want it to go too low, because if you bring it too low, that also leads to issues. So the issue of, yes, some textbooks, will put it there as ideal blood pressure, but it doesn't mean everybody has to have that. Between 120 and 129 is still considered.
What if someone now has 140/100?
Yes, so that is...
You said 140, right?
No, that's the cutoff for high blood pressure.
Okay.
You understand? So one is ideal or average blood pressure if you take many normal people, but what is the cutoff where we say that, okay, this blood pressure is too high, or hypertension is 140.
Okay.
Yes.
If it's 140
and above,
too high.
140 and above.
And above is
from 140
too high.
is too high. That is where we need to start considering treatment.
Okay. Now, talk to us about this fig. There are various kinds. I saw one. You use
wrist.
On the wrist, and someone is saying you have to level it to your heart and all those things. Are there some that people shouldn't consider? I know we are out of time, so you have 30 seconds.
Okay, very good. So what we encourage is we prefer, the blood pressure prefers the one that by the arm. The arm with the cuff properly sized, not too big, not too small. And then for those who thought use at home, they can use digital electronic ones is okay, and you can use to monitor and all that. And then so that is fine. The mercury sphere is something which is being phased out because of environmental issues, but that's actually the best, the most accurate, but it's being phased out. But the electronic one is okay, but we prefer the arm. And what people can do is they can validate. You should use, there are many brands, use validated ones. You can go online, stridebp.org. You can go and check whether your brand is validated, has been validated by regulatory authorities.
So don't wait till you faint or something before you go and check your blood pressure. From the age of 20, you should start having your blood pressure checked. The doctor didn't say that, I'm the one saying. So be safe. Start checking, because it will not give you any symptom. Don't forget that. There are no symptoms. Happy Hypertension Day.
Thank you very much. Same to you.
Dr. Oyewale Kushimo, consultant cardiologist, Lagos University Teaching Hospital, and he's also the Lagos State Coordinator, Nigerian Hypertension Society. I need to take a break. See you after this break, and we shall learn what we should do to bring up our boy children better. See you in just a moment.